Hi, I'm Dr. Karan, and welcome to Tech Talk. Today, we're exploring robotic-assisted surgery, how this technology enhances precision in the operating room, expands what's possible for surgeons, and helps improve recovery for our patients. Robotic surgery is an evolution of the traditional approach to surgery. Being able to do the surgery with smaller incisions, with more precise control, 3D visualization, in tighter spaces that we normally would not have been able to manage. It is a surgical platform. It contains all the instruments. The surgeon controls the robotic arms on the surgeon console, and that's how we do these surgeries these days. So let's look at what the Da Vinci system can do. So this is where the surgeon sits. These are how I control the instruments. The pedal controls the camera, which you can move in and out and look at another area. Let's try to do some stuff. So we're gonna put a stitch in, like we would in a real patient. And you can see how fine the movements are. As you can see, nothing moves on the patient unless I'm looking in. So once I put my head in, I can move the instruments, and that translates into pretty fine movements. Right now, we're magnified, but we can change it to higher magnification, even 10 times. We also have the technology to use another type of vision. This is called fluorescence. So we can give a dye to the patient and we can see different structures light up, and we can see them real time while we operate. Whatever was just drawn, I can see in here through this 3D vision, which helps us collaborate. So another surgeon can come and assist, and I can assist another surgeon and guide them for certain procedures if need be, or if there's a question. So we can draw on there, write on there instructions, and I can see that real time as it's being done. So what does this mean for the types of procedures we can now perform? Most people don't know that robotic surgery has been around for 20 plus years. I remember when I was in training, the robots were mostly used by urologists and gynecologists. With the current technology advancement, they're used almost everywhere now, with general surgery, chest surgery, even cardiac surgery. Robotic surgery has completely changed how we do general surgery. Like if we compare open surgery to robotic surgery, open surgery would mean a big incision where we would have to monitor you in the hospital for pain. That was the only way to do the procedure, and it would mean that you're staying in the hospital with increasing pain and monitoring for recovery. Nowadays, we can do it with small incisions and you go home the same day. So faster recovery, faster return to work or activity, and you don't have to stay in the hospital. Pain is much less, where most of our patients not even using narcotics. Ultimately, all of this innovation leads to meaningful benefits for our patients. So let's say, for example, heavier patient with a big hernia on the abdomen, we would have to open and then sew the muscles closed and then sew the skin closed, which is quite painful and leads to long recovery times. Now we can do it through 1 centimeter incisions, 3 of them, and then we can fix, doesn't matter how big a hernia it is. Most patients are quite thankful that they have smaller incisions and faster recovery. They're quite surprised that the pain goes away in a few days, so in some of the cases, than what they anticipated. Some of them have had open surgery, and it's a game changer for them because they have undergone the open procedure, so they can compare it to that. The less trauma we create while we're doing surgery, the less, again, pain, bleeding, infection rates, faster recovery, and it's longer lasting if we can do a better surgery with less trauma. Behind every robotic procedure is a highly coordinated surgical team. Think of the robotics system as an extension of the surgeon. It actually takes away the surgeon's movements and smooths them out, gives better visualization, and it doesn't allow us to do what we normally wouldn't do. So everything I do is what the robot does, not otherwise. The robot is part of the team. It's an instrument that the team uses. You still need your anesthesiologist to monitor the patient while we're doing this. You do need another assistant or a tech to be at bedside, so that they can exchange instruments and monitor the patient while the surgeon operates. As this technology continues to evolve, so does its potential. The robot is evolving just like any other technology. We have the capability now of what's called feedback. So when we grasp tissue, I can feel it transmitted across the instruments to my hands, even though we're not connected. There is also capability of watching the AI tell you what the next step should be, or even defining anatomy with different colors. All that is evolving technology, which is going to help us do safer, better surgery. The ability to seek outside help while you're in the operating room. The ability to maybe even someday do remote surgery in areas where there's not enough surgeons. I think AI has already had an impact on surgery, but again, it's passive. It's more information for the surgeon. Active involvement where the AI does portion of the surgery may be in the works, but I think it's too early to say if we can fully trust robots to do our surgery for us at this point. As we look to the future, this technology will continue to play a key role in how we care for our patients. At Dignity Health, we are committed to delivering innovative treatment options that advance patient care. As robotic-assisted surgery and other medical breakthroughs continues to progress, our approach to healing evolves with them. It's critical to stay informed, so thank you for joining us for this Tech Talk. We'll see you next time as we continue exploring the technological innovations shaping the future of healthcare.